Seryoso na ba?
Alis mo muna yung bangs mo. Char.
Medyo lukulukot eh.
What's up you guys, welcome back to my channel. If you are new to my channel, please don't forget to subscribe, turn on that notification bell for you to get updated for all my future uploads. By the way, my name is Raymond, your Pinoy nurse here in Ireland. Team, what's up? Hello! Okay guys, so this is another episode of our series, Nurse in Action, wherein I put the spotlight to those nurses who are working here in Ireland, especially in different departments, for them to share their working experience with us, and to give you an idea, how is it working here in Ireland? And now we are going to talk about operating theater, or as you all know, OR or operating room nursing. So before we proceed, just let me know which other department you want me to do. Just write it in the comment section down below. Guys, we have a very special guest and I am sure you will recognize her. And without further ado, let's meet her now.
Alright guys, so we are back guys. Kilala niyo tong guest natin today. I'm pretty sure that you will recognize her if you are a follower of FNI. If you are researching some things dito sa Ireland, makikilala mo si Mayora. Ladies and gentlemen, Miss Odessa Francisco. Hi ma'am!
Ma'am ka dyan.
Ma'am
Ate na lang.
Ate Odessa!
First name basis dito, di ba?
Yes,
First name basis.
O ate na lang.
Yeah. Actually, Odessa is a bit formal. Yen, yeah.
Yes.
Thank you, Mon. And it's an honor to be invited to be your guest. My name is Odessa Yen Francisco, kaya exclusively Yen, ganun yun. I'm 23 years of age, plus 23 years VAT. I'm from Cebu originally, from the Philippines. Hello sa mga bisdak. Shout out sa inyong tanan diya.
Hello.
Mayong
Yes.
gabi, mayong adlaw. 21 years nursing. I graduated in
21
1998.
years? Wow.
Yeah.
Such a
Yeah.
long time. Ate, I just want to ask, since 21 years ka, for sure, nakapagtrabaho ka in different parts of the country as well?
Oh, yeah. I was in the Middle East, like for 7 years. So, my first time abroad, I was in Saudi for 3 years.
Mm-hmm.
Finished my contract, I went to Muscat. So, I worked there 4
Muscat
years.
is in Oman,
And,
yeah?
yeah. That's the capital city of Oman. And then I moved from there, nag-cross country na ako, diretso na dito sa Ireland. Like, hindi na ako umuwi.
So
I only applied online.
at that time,
Online.
parang medyo madali lang application, no, ate? Did they
Yeah,
require
because
you
like
to...
I don't have to do OEC, like diretso na.
Diretso na. So, wala nang English exam before.
Yeah, I did IELTS sa
Okay.
Muscat na.
I see.
But
I
yung mga batch like from 2002 onwards,
Yeah.
like wala silang English exam required.
Ate Yen, so ang pag-usapan natin ngayon is all about your experience sa operating theater. Kung ano bang anong sistema dito sa Ireland with regard to operating theater. Ate, let me just ask you, how long have you been working as OT dito sa Ireland?
Going 13 years na po.
13 years. One hospital lang po yan. One hospital lang.
Oo, I've never
pioneer.
well, no, I was second from the pioneer. Totoo yun.
Okay.
I came like a year after sila nag-open. So, second. So, kumbaga, part na ng haligi.
Totoo.
Well, I was tempted to transfer to the HSC hospital.
Yeah, so you were saying you were working in a private facility.
Private hospital. Apologies, I cannot mention the name for confidentiality.
Yes, no
even in my vlogs, I never mention where I work.
Yeah, that's
Never.
acceptable ate. Napaka magandang ano yan kasi mostly yung mga na-interview ko na are working actually in HSC. So let's hear guys kung ano yung difference. 13 years ate sa operating theater. I assume you have a position already.
I do. I'm a
TNM
team
na ba?
lead for gynae. Team lead for gynae. Yeah.
Can you just give us your typical day sa
Alright,
operating theater?
My typical day will start obviously from changing into scrubs. And then our allocation and the rota is being done weekly. So alam mo na kung
Ahead
saan
of
kang
time.
theater. Even if I'm a team lead sa gynae, minsan I have to do like general list, ENT, urology, plastic, brachytherapy, except orthopedics because they have their own team. And sometimes I do circulate most of the stuff from the general side. So ginagawa ako rin. So like hindi lang like gynae on its own. After changing, magkakapi ka na agad. No, joke. no, pupunta ka syempre kung saan ka na theater. May tinatawag kami na cockpit checklist, yung safety checklist. So we also have the same. So basically, you prepare your theater for your theater environment for your patient safe. Check mo yung equipments mo, if they're all working and good. If not, you have to report immediately to the facilities to sort it out prior to start sa list mo. And then make sure you have all the instruments needed for your list that day. At saka yung mga extra instrument na kailangan marunong ka mag-anticipate eh.
Yes.
Oo. Pwede ka rin maging manghula na eh. Alam mo yon. So, kailangan na to ng doctors. I need to have this one. And you know what I believe in? I believe kung ready ka sa list mo, like you have everything from the instruments, equipment, supplies, if you have everything, less ang takbo-takbo sa theater.
Yes.
Okay? Because
Saka
you have
smooth.
everything eh. So,
Yes.
unlike konting takbo lang, and then if you are going to like itali mo yan at the end of the day, oh Jesus, ilang takbo pala ako. Then mapagod
Totoo.
ka unnecessarily. If you are the team lead of the day, you do a team briefing with your team. So, i-assign mo na kung sinong first scrub, second scrub. Sometimes I do scrub, circulating. So, alternate
Circulating,
yung
yeah.
roles.
Mhm.
Yeah, so I will be also the in charge for the breaks, 15 minutes in the morning, and then 30 minutes for lunch. Usually, nangyari pag ako kasi ang team lead, kapag break na sila lahat-lahat, ako lagi yung huli eh. Have everything, you have ready to go. We convene in the theater reception.
Mhm.
So, lahat ng mga teams mag-gather kami. And then we do the huddle or
Okay.
yung morning circle
Yes,
natin
yes.
sa
Okay.
atin. So,
Yan.
so then you will see your theater matron at yung mga team leaders from the other theaters. So, it's basically like pag-uusapan doon expected na mangyari during the day. Parang bird's eye view ba? Kung alin yung theater kailangan ng more staff later on. So, if your list is going to finish early, so you have to go there. And if one of your patients sa list mo is may kailangan na special equipment or may MRSA positive ba or COVID positive patient, so the staff needs to know.
Yeah.
If you need surgical assistance, so kailangan mo rin makipag-coordinate. May mga staff na absent, so kailangan mo rin i-cover. So, yeah. And then if you need to give out, this is the time because everybody will be there.
Yes, yes.
Ayun. So, kung may special concerns ka,
And I'm
yeah.
pretty sure it will be addressed, ate. Ate, let me just ask, how many hours yung duty nyo sa theater?
Here, I only work 35 hours a week. Yeah, nag-change yung management. I was asked if I could increase my hours to 37. It's only 2 hours difference, really. Like, compared to the Middle East, like, I used to work 45 hours per week.
40 plus, yes.
Okay? Or 40 or 45. Hindi pa kasama on-call nun na Raymond,
Okay.
Diba? Whereas dito,
Yes,
Jesus,
yes.
this is like holiday for me. So, increase din yung cheng-cheng kasi you work extra eh.
You will be able to earn more as well. You know, if you will do extra shift, if needed. Marami tayong free time dito, guys.
And I do on-call once a week during the weekdays. And then, I do 1 weekend on-call sa isang buwan. So, we do rotation.
Okay.
One weekend. And then, 1 weekend on-call, which means Saturday, Sunday on-call ka.
Malaki. Malaki din ba yung rate pag private?
Sa private, hindi masyado. Mas malaki sa HCC. So, I only work 4 times a week. Sometimes yung rota ko is 7:30 to 5. No nights, no weekend. And I only work 4 times a day. And then, since BFF ko si manager, can I do Monday, Tuesday, and Wednesday off all the time? Oh, sure, love.
Yes. You're living your life,
But,
ate, yan.
oh yeah, work and life balance, really. Di ganito sa lahat. So, in the bigger hospitals, for sure, hindi ganito. We're only like a daycare surgical setting na hospital. So, we do only elective elective cases. We don't do major complex surgeries. So, only minimum patients we do in the theater a day is at least 50 to 60.
Sa whole theater na yan,
And yes, so we have 6 theaters and 2 endoscopy suites and 1 minor op room. Probably from the 70, I only have 15 to do. So, it's fine.
But still a lot of patients, no? Kapag ganon. Kasi of course, you will prepare them pre-operatively, tapos intra-op, tapos yung post-op management pa, di ba? Iba pa yun. You mentioned earlier that you were a team lead at the moment. Dun sa bawat, for example, gynae ka na-assign, how many staff ang magko-cover, kunwari, sa gynae?
Okay, so like if you have a big list, minimum you will have 3 scrub nurses, like 15 above cases. And depended then if there are big procedures or if it's small procedures like cataract. Sometimes we do cataract in one list, like 25 cataract or 20. So you really need 3 to 4 scrub nurses.
Yes.
Kasi mabilisan eh. Yung cataract, 7 minutes lang yan mo eh. Then you will have 1 anesthetic nurse. And then we also have porters to help us with the positioning and everything.
And usually, ate, if you were assigned to, for example, the gynae, as you mentioned earlier, do you cover 1 OT bed or table, or you have 2? Or depende kung saan sila i-allocate yung mga pasyente for operation?
Usually only 1 theater.
1 theater for 1
Then
specialty.
1 after the other.
I see. Parang ratsyada nga yan, no? If you have 15 patients booked, Tapos sunod-sunod yon.
May anesthesiologist kasi minsan din sobrang bilis eh.
Mabilis
May
din.
mga doktor din na sobrang bilis. Pag ikaw, baguhan ka na nurse, talagang pressure
Mararattle
ka
ka talaga.
talaga. Oo. I usually advise to my junior, yung mga bagong recruit na nurses, you don't have to stress yourself. Like, it's okay to be overwhelmed. It really take time bago ka makarating kung nasaan kami eh, yung mga senior mo. Try to do your own part as well.
As I always say nga, di ba, experience is your best teacher. Minsan pag nagkamali ka ng isa, for example, you miss one equipment or instrument, mas maalala mo siya the next time, di ba? Huwag ka lang makakaharm ng pasyente, which is very important. You mentioned earlier about dun sa cockpit checklist. Can you just name yung mga few things na kailangan mong i-check sa theater ninyo?
Oh yeah. First is you put on the light. Very important.
Okay.
Yeah, do you think it's not important? It's important because kailangan mo i-check kung if all the bulbs is working. Kailangan naka-on na yung air filtering system natin. Kailangan yun. Lalong-lalo na sa COVID ngayon, kailangan yan. Yeah, the machines, the equipments, everything. And then, yung supplies mo, iba-ibang doktor, iba-iba din yung mesh, iba-iba yung sutures. Even the diathermy setting is different. And may iba ding doktor, may mga on-the-side request, yung favorite chair.
Totoo.
And then yung playlist nila, Mon, Diyos ko Lord, yung Spotify playlist, may mga ganon pa. Tapos may mga doktor din na, shh, bawal magchikahan sa theater. Ganon.
Depende talaga.
So, kailangan naka-note din yan. Oo.
Nag-OR ako nung nasa Pilipinas. It was really nerve-wracking for me kasi parang ayoko namang magbilang ng instrument. Hindi ko alam yung pinag-aralan natin yun, pero hindi ko matandaan yung mga pangalan ng Kelly forceps, iba-ibang forceps.
Oh yeah. So which brought me to the next one, yung struggle ko when I came.
Yes, please.
Kasi yung instrument names is different
okay.
from what I've learned from before. Like even like nagbabasa-basa ako ng libro before coming over, iba yung tawag nila. Plus yung mga doktor, may mga pet name pa sa mga instrument na yan. Can you give me bunnies? Ano yung bunnies? Bunny rabbit? Tooted forceps, tooted forceps.
Okay, kasi okay.
Oh yeah, or ang iba gaganon lang.
Yes,
importante yung attention to details din.
Yes.
Oo. Aside from magaling ka mag-anticipate, kasi lahat ng gamit mo kailangan accounted for yan. Ang no-no talaga sa lingwahe namin as a theater nurse, yung mawalan ka ng instrument.
Yes.
Safety ng pasyente, yung tinatawag namin na timeout. So a timeout is, ito yung ginagawa namin bago mag-start yung procedure. Actually, it has a three stages. So, una ginagawa sa ward, then sa reception, which is done by your anesthetic nurse and the anesthesiologist. And then the last one, prior skin incision, is the whole theater team na. Your surgeon, your anesthesiologist, scrub nurses, everybody who is in theater. So we do the timeout. So we call out the patient name, the procedure, and the site. So like kunyari, patient is for hernia. So left side. So titingnan din kung may nakamark doon sa left side niya.
Yes.
So importante yan. Kailangan yung nakalagay dyan na imaging bago. Minsan nangyayari to like yung imaging sa pasyente na iba napunta. That can happen too. And then also, you need to be careful. Minsan yung patient stickers, yung labels, napunta sa ibang chart. That can happen. That can happen too. So you really need to be careful. Especially also, if you are going to take samples, like specimen. Kasi kahit isang mali lang sa spelling sa pasyente, tatawag kinabukasan yung lab. Bakit ito an without E at an with E itong nandito? So, kailangan pareho sa specimen pot, sa book mo, at saka sa register sa lab. Kailangan pareho sila. And always check it with the other nurse para may witness ka. Always.
Ate, thank you for that information. And nasabi mo na din yung experience na yan. Do you have any crazy experience about the kind of thing?
Yeah.
Not catastrophe, pero something like that.
Hindi man, pero blooper. I was doing my adaptation in the HSC, in the regional hospital. Nag-scrub ako ng hernia. You know, during that time, we were using the reusable drape pa eh. We used like, yung towel clamp.
Yes.
Nung nag-count na ako, bakit kulang yung towel clip ko? Nasaan? Tapos sabi ko, nilift ko na yung tray ko, wala. Tapos sabi ko, siyempre, I have to inform my surgeon, kahit naman hindi nila ginamit sa loob, di ba? Tatawag na sana kami ng portable x-ray, di ba? Just colored. Yung yung RMO niya, yung alam mo, yung pala, yung pantalon niya, yung thread, lumuwag.
Okay.
So para hindi mahubo, kinuha niya, clinip niya, without telling me. Oh, Genie Makers. But Marami pa sa theater, pero yung iba medyo green na, so hindi ko na i-share.
No worries, ate.
Nangyayari din yun.
Yeah, so you mentioned one thing about the adjustment that you did. So yun na nga, isa na nga dun yung sa instrument. Any other adjustment that
Yes.
you had to do during the first few years
Language.
or few months? Language, okay.
Nag-a-adjust pa rin ako. I'm still learning. Kasi yung slang talaga nila, Mon. Sa atin, di ba, may taga-Bisaya, taga-Tagalog.
Totoo.
Hindi ibig sabihin na Irish ka, yung English nyo pareho.
Yes.
Iba-iba din yung tono kaya. May tonong Bisaya din, may tonong kumakanta, may tonong matigas. O may kwento ako. Mahilig ko sa kwento.
Sige lang,
Vlog ko
ate.
ba to? Vlog ko ba to? Kasi they have mga words of endearment ba dito, no? Sometimes they call the patients pet,
Yeah, pet,
petal,
yes.
flower, ganyan. So, like, actually, he was like more senior than me. So, sabi ko, how are you, pet? Sabi ko sa pasyente. Tapos, nilagay ko na yung mga ECG dots niya, ganyan. Yung kasama ko, Pinoy din actually siya, Mon. Sabi niya,
Yes.
girl, hindi pet yung pangalan niya. Sabi ko, ano ka ba? Hindi mo ba alam yung pet? Ano yan dito ay parang words of endearment.
Yes, totoo. Alam mo, may
Okay.
ganyan din ako experience, ate.
Oo.
Na-experience ko naman yun sa colleague ko. Bago-bago lang din ako sa Ireland at that time. So, yung mga few months lang. Tapos tinawag niya,
Oo.
hey, pet, can you give me this, thing? Kinausap ko talaga siya. Pinoy din siya.
Oh.
Sabi ko, why are you calling me pet? Do I look like a dog?
Aw.
So, tinanong ko talaga siya kasi parang akong na-offend ba? Kasi hindi ko, tapos sabi niya, hindi ganun yun.
Pero careful lang ha, kasi
Yes.
better to address your patient actually sa name talaga
First
nila.
name nila. Yeah, based on my experience din dito, ate. For example, they have their first name, yeah, but they want to be called a different one, their nickname. For example,
Yeah.
the patient's name is Anthony, so they want to be called, no, call me Tony.
Tony. Oh, by the way, speaking of that, sa atin, di ba, Mon, we call everybody, or we address everybody doctor. Dito,
Ito, iba.
pag surgeon ka, mister ang tawag nila sa'yo, or unless prof siya. So, you don't call him doctor. Pag
Oh.
anesthesiologist, doctor, we call them doctor.
Sa unit naman namin, talagang first name basis lahat. Maski, unless,
Pati mga boss ko.
yeah,
Yeah.
unless mga professor nga, yung tama ka naman, parang very uncomfortable sa kanila tawagin sila ng doctor, parang nakakatanda.
Oo.
Ganun sabi nila. Ate, COVID response. You mentioned earlier about COVID. How did your unit cope up with this unprecedented situation?
Like everybody, we don't know what to do. First lockdown natin was in March, right? HCC took over the private hospitals. Some of us were redeployed sa ibang HCC hospitals. So we have to do their elective essential cases. Pero nung tinok over na kami ng HCC, so naging busy kami. And then our PPE protocols guidelines as well has been changed. Kailangan namin mag-wear ng PPE. So FFP2, yung mas na tawag natin.
Yes.
Initially, nahirapan talaga ako doon. Ang hirap kaya huminga.
But have you handled, ate, one case na, for example, nag-assist ka or nag-scrub ka na COVID positive?
No. HCC said we will keep the place like clean hospital.
Clean. Okay.
Yeah, so walang COVID cases na dinadala nila dito. Most of our patients are COVID tested naman eh. So,
before the
negative
procedure.
na sila bago namin gagawin sa hospital. Unless kung minor procedure lang, so we don't test them.
Sorry to ask this because I always ask all my interviewees, were you contracted by the virus or no?
Wala naman, awa ng Diyos.
Awa ng
Wala
Diyos.
naman.
Ireland is very diverse and we have a lot of nationalities. And I'm sure in your unit as well, marami ding ibang lahi. So how do you deal with them?
Alam mo, ako lang queen ng theater dito kasi walang ibang Pinoy.
Wow!
No, they were here when I started in 2008. Like, they were here like for a year or and a half. And then they all left to Dublin. For the last, at least 10 years, like walang Pinoy. Ako lang mag-isa. May Asian na Chinese, best friend ko rin siya, senior na rin siya. So kami lang. So if I'm having a bad day, so at least may body ako na doon ako nag-give out. Siya din the same with me. In general, the Irish, they are very professional. Some of them, nurses are different. Some of them are very technical. Ang iba, very linear. Talagang bookish, by the book sila. But you know what? They're always very friendly and very helpful. There's always a good crack and banter in theater. I can tell you that.
Yes.
Kailangan open-minded ka lang. And then, may ibang lahi din. May mga European din kami. May mga Polish.
I just want to ask, ate, do you feel or did you feel some inferiority complex?
I'm lucky, Mon, kasi hindi ko naranasan mabully.
Okay.
Promise. Oo, like they're very like welcoming when I came. And then Though, doon talaga sa language barrier, nahirapan ako.
Yes,
But
yes.
they are very helpful talaga pag may tanong. And then they always like look after me if I'm okay. They always ask. Inferior, no. You know why? Because team oriented kasi yung
Yes.
working scheme natin dito, no? Like,
Teamwork talaga.
they encourage being assertive. So, they value your opinion talaga.
Saka yan yung matututunan talaga ng mga aspiring nurses pagpunta nila dito. Kasi sa Pilipinas, kung paano, alam mo, hindi naman sa pag-ana, may mga cases talaga na parang yung doctor talaga, I'm the doctor. Pero dito talagang you have certain autonomy wherein you can say something talaga for as long as for the safety ng pasyente mo.
Yeah. May isa akong ENT surgeon and his forte is rhinoplasty.
Okay.
Alright? So, favorite talaga niya ako na scrub nurse. So, pag may ginagawa siyang rhino, palagi siya nagtatanong, Odi, they call me Odi in theater by the way. Is this okay now? Pumasa na ba to sa standard mo? Lagi niyang tinatanong, King, but he always asks my opinion. Sabihin ko naman, konti pa dito, gagawin.
Talaga, kahit pa paano talagang very, sila, parang family-oriented somehow din dito.
Oo, doon tayo, alam mo, doon tayo nagkakalapit, no?
Yes,
yung kulturang Pinoy at saka Irish. Doon.
Totoo.
Kasi very family-oriented sila.
Being here for 13 years, let me just ask, how did Ireland change your life?
Professionally, yes, I'm more empowered. And then career advancement, yes, because they're very helpful with the studies. Like if you want to take up some studies, obviously, like equipment natin dito mas more advanced eh.
Okay,
yun? In the olden times, we used to do abdominal hysterectomy, like open. That now we can take out the uterus through the keyhole. Small incision.
Wow.
So, ganun naka-advance. Financially, yes, being a breadwinner, I was able to provide and help, especially when my parents had health issues, both of them, one after the other. Kung nasa ibang bansa ako or sa Pilipinas ako, hindi ko kakayanin yung treatment nila. Ayaw ko mayak. Yun talaga malaking tulong. Sa personal naman, work and life balance. Sa sobrang bored, nagbablog na, joke. I'm also plantita, so may time ako sa mga
nakita ko yung vlog mo doon. Ang dami mong halaman.
It's an addiction actually. Masamang addiction to.
One question regarding your citizenship here. Since you are Irish citizen, dual citizen ka?
Oo, kailangan ko mag-dual, especially now, ng COVID. Hindi ka pwedeng umuwi sa Pilipinas kahit gaano ka-emergency yan kung wala kang Pinoy passport. And then, if you are going to buy a property, pag Irish passport ang gamitin mo 12% yung interest ng loan. Oo. So, kung Pinoy passport gagamitin mo, at least 6 to 8 lang.
Parang magandang content yan next time.
Gawan mo! Oo. Para may series ka rin, Wala naman siyang major difference kung Irish ka ito or like Pinoy ka pa rin. Like, taxation is the same.
Yes.
Like, you will not have a bigger salary because Irish ka. No. Yun dito, equal ang pagtingin nila sa atin.
You know what? I really hate to end this kind of conversation, but I think this will be my last question for you. You mentioned a lot of tips and advices already. Can you add more if you still have on the list?
When you apply for a registration, it will take time. So, you need to be patient. Kung may naghahanap ka na employer, tapos tinorndan ka, hindi ka natanggap, huwag mawala ng pag-asa. Keep on chasing your dreams. If you are going to take up adaptation or RCSI, regardless, you have to be prepared because hard work and then samahan mo na rin ng prayers equals success. Hindi mawawala yan, lalo na yung first month mo dito is homesick ka talaga. Try to live kung nasaan ka ngayon.
Yes.
Oo, hindi yung homesick ako, lugmok na ako sa kwarto. You do something. For the theater nurses, like coming over, as I've said, keep your calm, keep your pace. It's okay to be overwhelmed. Huwag ma-stress. Always good to be honest. If hindi mo alam ang ginagawa mo or gagawin mo pa lang, sabihin mo sa senior mo or sa preceptor mo because they are very helpful yung mga nurses talaga dito. Kahit experience ka na sa ibang bansa, huwag mong magaling kasi it's always nice to be good, as I've said.
Thank you so much for your time. Okay, I really appreciate it.
It's an honor talaga, Mon.
No. It's an honor for us, for me especially. Kasi guys, sabi ko nga, bago pa ako pumunta dito, pinapanood ko lahat ng video niya. Alam mo yun, yung mga tips, how to get here and all that. At the end, this is your chance to promote your channel once again.
Hi all! Hi sa mga subscribers ni Raymond. Una-una sa lahat, don't forget to subscribe to Raymond. Follow his series as well. Not only his series, yung vlog niya. Kasi mas latest yung information ni Raymond sa vlog niya. I also do health tips. So hindi lang nursing in Ireland.
Yes.
And then if you want to see like the life vlog, so I also do. So anyway, don't forget to subscribe exclusively yan in YouTube. I have also IG account exclusively yan and then Odessa Francisco for Facebook.
Okay guys, so please don't forget to follow Ate Yen's channel exclusively yan in YouTube, guys. And once again, thank you so much for watching this episode, which features our operating theater nurse,
Theater nurse.
Odessa Francisco. Yeah, thank you, ate. Thank you. Once again, guys, thank you so much for watching this video. And if you haven't done it yet, please do subscribe to my channel. And please follow my Facebook page, Nurse Raymond 123. Okay, I'll see you on my next episode. Bye!